Good afternoon, everyone, and welcome to today's webinar, Leading Through Change, a C-Suite Conversation. Today's C-Suite Conversation is sponsored by Axxess, so a big shout out and thanks to them. Before we dive into the idea of leading through change and kind of touching on some current events, I did want to go over a few quick housekeeping items. First, please note that your lines have been muted for sound and audio quality. Also, HHCN will be sending a recording of this webinar to all attendees, so if you miss something, don't worry, we have you covered. You'll be getting that soon. And lastly, you'll see on your screens that there's a little gray box probably towards the top right corner. You could use that to send in any questions you have throughout this webinar. My main focus as moderator is going to be hearing from John and Jennifer, but if we do have a few minutes towards the end of the hour, we'll try to sneak in a couple of crowdsourced questions into the discussion. Okay. So let's go over a little bit of bio here on our speakers for today. First, there's me. I'm Bob Holly, editor of Home Healthcare News. I'm going to be your moderator today. Originally, Deb Hoyt from Axxess was going to sit in as moderator, but I kind of lobbied strongly enough to secure those duties for today. Deb did spearhead the direction of this webinar, but was gracious enough to hand it over to me, so thanks for that. And as for the stars of the show, first we have Jennifer Sheets, who's the Chief Executive Officer and President of Interim Healthcare, Inc. Jennifer has a wealth of knowledge in the overall healthcare space. She began as a trauma and transplant ICU nurse before advancing to the CEO roles. And she's held those positions in both the hospital space and the home-based care space. So a lot of great background there. Jennifer, of course, also serves as CEO of Caring Brands International, which is Interim's parent company. So she has an international perspective as well. Again, incredibly valuable for this conversation on change and touching on some of the current challenges in the healthcare ecosystem. And as a quick side note, if you do want to hear more from Jennifer on leading through change and navigating the coronavirus, check out Home Healthcare News today. R. Bailey Bryant did a great Q&A with Jennifer, and that's up on our site. As for our second speaker today, we also have John Olajide, the founder and CEO of Axxess. In his role, John leads the strategic vision and direction for Axxess, a Dallas-based global healthcare technology company that really specializes in innovative cloud-based software for home care, for home health, and for hospice agencies. We're hearing from John today because he's somebody who is constantly trying to lean into change, especially on the tech side. He's a big advocate for improving the quality of healthcare services by leveraging strong technology platforms. So that's going to be important to bring into the mix today. John is also somebody who's just very passionate about corporate culture as well. And that's obviously a key ingredient to change. All right, well, now that we have an idea of who we're hearing from, let's just quickly go over our objectives for today. Jennifer and John are both recognized innovators and leaders who share a strong core belief that the future of healthcare is in the home. And that's something that I obviously believe in as well as editor of HHCN. The future of healthcare, especially during this public health emergency, is in the home. John and Jennifer both have that international perspective. They're both very familiar with the power of home-based care and how it can transform our nation's healthcare ecosystem. So yeah, over the next 50 minutes or so, we're going to just dive right into a conversation with John and Jennifer. Jennifer is going to bring that clinical and operational perspective, and then John, he's going to bring that business and technology perspective. On a high level, our three main discussion points are going to be: one, leaning into change and how that's more critical now than ever before. Two, how the COVID-19 pandemic is presenting an opportunity for home-based care, for the home-based care industry to demonstrate its leadership and value to clients, communities, provider partners, and perhaps most importantly to CMS. And that third major point we're going to focus on: how the nation's strategic and intentional downshifting care to the lowest cost setting provides opportunity for home-based care provider growth and scale. All right, now that that's all checked off, Jennifer, John, thanks for joining me today for this conversation.
Thank you so much for having me.
Thank you, Bob, for having me. Thank you.
Where are we hearing from you guys today? I hope you're all holding up okay.
I am in Charleston, South Carolina, doing well, getting a little tired of the home office, as is everybody, but thankful that so far so good. My family's safe, and so are the employees at Interim.
Excellent.
And John, how are you doing?
I am doing wonderful. I am dialing in from Dallas, Texas. I'm actually in my conference room, and I am practicing physical distancing. I'm one of 2 or 3 people in the entire organization because we had made the early decision for everyone to work from home. So I am safe and sound.
All right. Well, I'm glad sounds like you're doing well. We're going to go ahead and get this discussion started. And Jennifer, my first question here is for you. As a global leader in the continuously evolving home-based care space, you must be constantly challenging yourself, both personally and professionally, to see beyond the immediate priorities and imagine, what the future holds. Can you kind of share some of that insight into your day, some insight into your strategic thinking about leadership, and kind of describe your definition of leaning into change?
Yeah, absolutely. First, let me say that I am extremely lucky to have the opportunity to build on Interim's legacy of 50 years in the home care industry. Interim, as you probably know, was the very first home care company in the U.S. And then, like you said earlier, I also lead the parent company, Caring Brands International, which includes Bluebird Care, which is the leading brand in the UK and Ireland, and Just Better Care, which is the leading brand in Australia. So the strength and kind of rich history that these companies bring really allow me to run a lot faster than I know I normally would be able to for a company, of this size and scale. So international leadership, especially in the midst of the crisis that we are facing globally. My day starts about 5:30 in the morning and ends around 10 p.m. at night. It seems like the UK and Ireland get going around noon their time, so that gets me started pretty early, and then Australia gets going about 7 a.m. their time, which is my evening. And then I have Interim in the middle. So it's definitely been challenging from a time perspective. But the reality is, it's become very clear to me that we're all trying to solve the same issues in the home care space. I can literally sit in Australia and talk to, one of our offices there, or in the UK, or in Ireland, or in Saudi Arabia, or anywhere else that we are, and everybody is trying to solve the same problem. We're trying to increase the supply of talent that we have to meet the care demands that we face. And even before the crisis with COVID-19, there's already this perfect storm coming that is going to add so much more need for the services that we provide. So I think everybody in the industry would agree that's our biggest challenge. And then on the flip side of that, the other thing that I've really seen as a common issue across, every footprint is that gap related to what home care truly can do, the acuity and complexity of care that home care provides, and what it can cover across the globe. So for me, those have been 2 big focuses that I've had more on a global scale, certainly even before COVID-19, but it's even more at the forefront at this point.
And I know that you're also working pretty hard to lead from an advocacy perspective as well, correct?
Absolutely. So, I personally am involved in several task forces that meet daily, sometimes multiple times a day, really reviewing, addressing, and advocating for the home care industry. We have really worked on, first of all, again, educating other parts of the healthcare industry to understand the important role that home care can play. So at a time where folks are saying increased capacity in your hospitals, skilled nursing centers are not allowing COVID patients back in, or they have their own issues with cluster COVID outbreaks. Home care is the answer. And you just kind of scratch your head, especially when you're in this industry, going, how do people not see the critical role that home care can play? So a lot of the advocacy work that I've been doing in the groups that I'm involved with are really focused on is making sure people understand that critical role that home care plays. The good thing is when you get to the right person, certainly they understand and they listen. And obviously we've seen some good changes come through. For example, early on, the Department of Homeland Security releasing communication calling out home care and hospice. That was huge for us as critical employees. We're seeing some states follow and definitely some enhancements to waivers and clarifications from a technology perspective. So my hope is that the more people realize truly what home care is, the more we'll be at the table for these conversations versus an afterthought.
And John, I'm going to turn the conversation over to you in just a second. But before we do that, since this idea of leaning into change is the common thread throughout this webinar, Jennifer, I did want to ask, what does that really mean to you? What does leaning into change, mean?
I think it's important when you're in healthcare, regardless of what sector of healthcare you're in, to realize that the things that you have always done are not going to be the things that are going to get you to the next level in the future. We have a whole different type of decision makers coming up. We have new generations that respond to different tactics than we've used in the past. That's one piece of it. We're moving into a more technological world, and I know certainly John will be talking about that, but that's another piece of it. And the reality is we have a consumer that demands more transparency, wants insight into quality information, wants the ease of being able to, follow their healthcare or their loved one's healthcare in a virtual format. And so I think for me, leaning into change means really always thinking about the next evolution. I think you have to come into certainly healthcare to be thinking about continuous process improvement. What does healthcare delivery look like now in the home? What does it need to look like in the future if we truly are going to continue not only to impact the quality of life that the communities that we serve have, but also if we're going to continue to be ready to meet the surge that's coming into our space. So for me, it's being open and it's never being satisfied, getting one project done or one standard in place and then already thinking about what's the, version 2.0 going to look like.
All right, John, you launched Axxess 13 years ago with the goal of revolutionizing the future of home-based care delivery through cloud-based handheld technology, again, for home care, home health, and hospice agencies all alike. You're also incredibly active within the Dallas business community. Tell me how Axxess is innovating, how Axxess is changing. Give me some insight into your strategic thinking about leadership, and then I'm going to ask you for your definition of leaning into change as well.
Thank you, Bob, for the opportunity to have this conversation. And, I just want to start off by saying what a remarkable job Jennifer Sheets is doing leading her organization, Interim, and our industry at this time, Jennifer. And we are proud at Axxess to be a partner with Interim and Jennifer to empower the delivery of the highest quality care in the home. So thank you for the opportunity to talk about all that. I think it's important to first and foremost talk about what I believe in, what we believe at Axxess, what drives everything that we do. We believe at Axxess that the future of healthcare is in the home. We believe that all our people at Axxess, we call them Axxessians, we all believe that. And technology, cost, patient choice, all that is driving healthcare home. And that future that we're talking about is not in the future anymore. It's what we're dealing with now. It's sad that COVID-19 has really, it's right at our doorstep, and we're dealing with this day to day a lot quicker than we ever anticipated. And our vision at Axxess is to be the most successful global healthcare technology company, most admired for its people, partnerships, and solutions. It's important that I get that out. And then our mission is to empower healthcare organizations and professionals with the world's best technology solutions. That's what we think about every day. That's what we get up wanting to do. That's what drives all our actions. So I'm excited that we're talking about leadership today. So it's important that I really underscore what I think leadership is. So as we talk about this, the way I see it, leadership is accepting responsibility for a desired outcome. This is the outcome that I want. This is where I want to go, and I accept that responsibility, and I'll do all I can to lead and challenge and coach and support others to do that. And I think when you accept that responsibility, what you do is you empower yourself and others to weigh in. Secondly, at Axxess, you asked about my strategic thinking about leadership and all that. Our culture drives everything that we do, and our culture at Axxess empowers us to be an industry and community leader as well. And then thirdly, at Axxess, as I mentioned earlier, we work hard every day to empower the delivery of the highest quality care in the home. So at a time like this, we all know change is inevitable, but change is even more critical now with this COVID-19 crisis and all these things that are going on in the world. And as I think about it, communication and collaboration are critical. You need to communicate some more. And as a leader overall, and especially at a time like this, you cannot over communicate. And when you're dealing with change, you cannot go it alone. And especially when it's unprecedented change, as our communities and our world face today, you have to collaborate with people. And it's important that you have a culture that helps you do that. So we have a leadership culture at Axxess. It's a may the best idea win. It doesn't matter where the idea is coming from. We all want to make sure we work together and do the right things for our clients, for our community, for our industry. So leaning into change, what that means to me is leaning into growth. With change comes new opportunities, new ideas, new learnings, new ways of looking at things. And I believe leaders must have a learner mindset. With the crisis that we're dealing with today, there's no playbook for this. There's no instruction manual. So in a lot of ways, you learn as you go. But if you have a culture where you've always done that historically, this is just muscle memory. This is what you do every day, and you lean in and you empower your people, your clients, the entire industry to say, hey, we don't have all the answers, but that's okay. We're going to lean in. We have a learner mindset. We're going to keep doing all we can to learn as we go and move this along. And I think it's important to have a culture that does that. So at Axxess, our culture makes it easy to lean in because our culture helps us understand what we need to do for our people, for our clients, for our partners, for the community. So you mentioned that I also play a role as a leader in the Dallas community. So for those of you that don't know, I'm the chairman of the Dallas Regional Chamber of Commerce, and it's really leading the business community in our region. And we're dealing with COVID-19, we're dealing with shelter-in-place orders, and we're thinking about all that. So I've had to galvanize the business community to make sure we're totally aligned to do what's right for our community. I believe it's essential that we can leverage all the wisdom that the business community provides to help our political, our community leaders, and get all the best thinking that's necessary to help us get through this. So now the way we see this in our community and other communities nationwide is how can we save as many lives as possible? How do we make sure that we don't overwhelm hospital capacity in all our different regions? And then lastly, how do we prepare for the future? I like how someone articulated this to me a couple of days ago. They said we need to flatten the curve. You've all heard that. We need to fight. We need to, and then work for our future. But it's important that we create the culture, the online foundation for how our businesses, our clients, our community in general is able to get that done. And I think once you create that ecosystem for collaboration and open communication to happen as leaders, it's easier to lead and do the right thing for all stakeholders.
So I think that it's pretty obvious to me that both of you as individuals lean into change, and it sounds like both of your organizations really embrace change. As a quick follow-up question, do you think that, Jennifer, looking at your peers at the home-based care industry itself, do you think that providers normally are quick to run toward change, or do they typically run away from it?
I think it depends on the culture of the organization and the leader. For the most part, I think in the healthcare industry in particular, we have to embrace change more than any other industry. I mean, our setting, certainly in the home health space, is constantly evolving. We talked about the needs and more people coming to our setting. So I think in healthcare, we are a little more comfortable with change. Certainly from, even the clinical perspective, no patients present exactly the same. You have to always be able to respond. And I think in business, we have to be the same way. So I would say my personal opinion is healthcare compared to other industries are certainly ready to respond to change. The speed at which businesses prepare for change is what I think varies. And I think we always have to start early, thinking about, again, what potential could be there in the future. So, for example, we started prepping for COVID-19 in November, before it was really even an issue in the U.S., just in case we were going to see, we're going to see it come to our country. And, we were, I think you may know this, but we actually staffed the Kirkland Nursing Center in Washington, which is really where COVID-19 entered our country. And so the fact that we had done that preparation in November and then really enhanced our efforts in January as those cases started to appear, I felt like we had a leg up on adapting to change as we needed to.
Mm-hmm. And we're going to take a deeper dive on the COVID-19 virus in just a second. But John, same question to you. You work with a lot of home health, home care, and hospice agencies. Do you think that these providers are quick to run toward change, or do they more often run away from it?
I think historically, because of the nature, as Jennifer mentioned, because of the nature of the work that we do, the only thing that's constant in our industry is change, regulatory change, all types of other changes. I know early on this year, what we were thinking about was PDGM, and we thought that was the biggest change in 2 decades in our industry. I guess little did we know that there was much, much bigger change that we're going to be confronted with very quickly. So I think in our industry, providers are accustomed to dealing with change. And the role that we play at Axxess is how we can partner with them to make sure we can accelerate meaningful change and help them with the most change management tools to help them be successful. When I'm leaning into change, there are 4 things that I focus on all the time. The 4 things are culture, leadership, communication, growth. And I want to explain what I mean by that. On the cultural side, for our organization and with our clients, it's important that we nurture, foster, lead by example, may the best idea win type of scenario with ourselves and with our clients. And then the second thing is leadership. We want to make sure we're leading by example. We're building other leaders. So we see ourselves as a partner with home health organizations to help them be successful. We have something that we call the Axxess Way in our organization. And what it really does is it spells out what our commitment to our people is, what our commitment to our clients is, our community, our partners. And our clients have come to expect that at Axxess, as things change, they expect us to communicate and share information with them. So we lean into change with our clients, even with the thought leadership that we provide. We want to make sure that we're bringing them all the best information that's necessary to help them be successful. You mentioned public policy earlier in your question to Jennifer. And in our organization, it's unusual for a technology company to have a public policy leader. So you also mentioned Deb Hoyt's name earlier. So we have a leader in our organization focused on public policy. So in this industry, you cannot lean into change if you're not paying attention to all the regulatory change, for an industry as regulated as ours is. So for Axxess and our clients, we lean into that change with thought leadership, making sure we understand what's happening policy-wise, and we're communicating and collaborating constantly and partnering with our clients constantly to make sure they know we're in this together. And because we believe in carrying the home, we're not just providing solutions that we can hand off. We're working alongside them in lockstep to make sure our industry is seen as a center of excellence, and that we can empower everyone that we do business with, whether they're our client or not, with all the tools they need to deliver the best, absolute best care in the home.
All right, well, let's turn our attention now kind of exclusively here to the COVID-19 pandemic for a second. Jennifer, it's obviously an extraordinary, unprecedented challenge, whether you're talking about PPE or workforce issues, or just learning how to provide the quality of care that you need to for COVID positive or suspected patients. At the same time, it's also a huge opportunity for home-based care providers to kind of prove their mettle throughout the continuum. How are you navigating this very difficult time for Interim?
First of all, I absolutely agree. It is our time to shine, and I think that this is a great opportunity for us to do just that. And the reality is, whether for a natural disaster or an epidemic, our standard is really clear: to be ready no matter what, with an established plan and always thinking about the next step. So, from my perspective, while others are panicking, healthcare workers, and in particular home healthcare workers, are facing this virus head on and are refusing to back down. Specifically in home care, my belief is we are made for this challenge. And at Interim, and certainly across our other brands, we are leaning into the challenge. Our clinicians are gifted and they're well trained to provide, complex, high acuity care without the luxury of grabbing another person to help or being able to push a code blue button in an emergency situation. We're not saying no to referrals or admissions. We're already serving COVID-19 positive patients. And our goal is to respond to the needs of the people in our communities. They need us now more than ever. And because home healthcare professionals are really uniquely dedicated to the home space and the clients and the patients who need our standard of care most, we stand ready, right, to respond. And the reality is, it's not only a place to receive quality care, it's also the place that best prevents the spread of the virus. If you're in a home setting versus a setting with, a hospital setting or a skilled nursing setting or somewhere where there's multiple folks housing together. So in particular, just to get you some of what we've been doing to prep, things have kind of dropped into a few different buckets. The first being what we hear all over the place, which is really safety and personal protective equipment. So we've really, again, tried to step up to this challenge where we are not waiting for or hoping for a handout from the CDC or from the states or for donations, which would all be wonderful. But we've actually mobilized pretty quickly and immediately started to prepare. So we started to find reputable suppliers, both domestically and abroad. So we leveraged our global footprint to find access to PPE in other settings. And we've extended our group purchasing to other agencies in the home care space that are struggling to find PPE, so that we can leverage bigger buying power across the industry to have ourselves at the table with hospitals and other large organizations. The other thing that we've really invested in is supporting our employees. So we lead with our values, and really it's about figuring out how to best support those impacted, including, all things, right? Guidance on PTO, FMLA, workers' comp, unemployment benefits, and above all else, really showing appreciation and deep, gratitude during this chaotic time. We're facing unique challenges, in particular with the change in the unemployment benefits, right? We've actually seen in pockets across our network, folks have been requesting to be laid off because, quite frankly, they can make more money staying home. And, while I was not privy to the decisions, and everything that went into that decision, it has backfired a little bit. And the reality is we need to be incentivizing people to be working during this crisis, especially home care and healthcare workers that we need on the front line. So I think it's really important that while we're waiting for regulations to sort themselves out, and I think they will, I think we're already advocating very heavily for some changes there and recognizing certainly the investment and commitment of the frontline healthcare worker. But above all else, right now, we're doing everything we can to show appreciation for these people. Supporting operations is another key area for us. So we really have spent a lot of time gearing up to creatively support our community demand. So we're working with referral sources. What does a transition plan look like for a COVID-19 patient? How do we reinforce clinical excellence? How do we make sure that we have set a standard for everybody from Interim going into a home? What does that look like? What are we going to do? How do we make sure that, again, referral sources know what they can expect when we're in the home? Technology, again, I know this is certainly John's area of expertise, but for us, we are putting a big focus on technology, communication, and telehealth. We added new virtual channels, really expanding our ability to care for patients in the home, and then also clearing a path to work with all of our stakeholders. We, right out of the gate, launched a dedicated website, COVID-19 at interimhealthcare.com, and we have a real-time Q&A. So anybody can go in and say, hey, I'm wondering what I do in this situation, or here's a new challenge, or I haven't seen this before. And what we try to do is everything that comes in each day before noon, we answer the same day. We've gotten a lot of great feedback about that, but it's really about making sure that we're opening up every channel that we can so that we can communicate with candidates, with employees, with referral sources, with facilities. We've transitioned our recruiting. We are not slowing down recruiting. We need every single frontline worker we can get. We've just switched that to a virtual experience. And so, our goal is maintaining in all those scenarios with all those stakeholders that same level and expectation of excellence through, a virtual delivery. So, the other two things that come to my mind, I think, in preparation specifically to COVID-19 is preparedness. Again, contingency planning. I still think most indicators suggest that really the apex is still a few days away or a few weeks away in some metro markets. And it's going to start to domino in coming weeks throughout the country. And that is when, my honest belief is that is when the home care industry is going to see this surge in demand. What data, scenario planning, and readiness can we embrace now to be ready? And that's what we've been focused on. And then finally, we talked about it a little bit earlier, it's advocacy, advocacy, advocacy. Again, I am directly, personally, directly, and intimately involved in multiple task forces, and we are reviewing, addressing, advocating for all things home and community care. In the last few weeks, and I think this is the important piece to call out here, in the last few weeks, these task forces and advocacy groups have gained audiences with Vice President Pence, Administrator Verma, CMS Administrator, Homeland Security, Calder Lynch, and many top state officials. And the real thing I want to call out here, especially for the folks listening, is that people are listening, and the reality is, collectively as a home care industry, we have a very large voice, and the time is now to come together as home and community care providers and realize that we're all in this together and we need a collective voice.
Mm-hmm. You mentioned how this is kind of, this surge in patients, we're still kind of going to see that in maybe a couple of days, a couple of weeks. And it definitely does feel that like we're in the calm before the storm right now when you look at the home-based care landscape. John, I want to go back to you now for a question here. Let's talk more about what you're doing at Axxess in regard to the COVID-19 virus, but also what are you doing, within the Dallas business community to help lead on COVID-19?
Excellent. Thank you, Bob, for that question. I mentioned, I mentioned to you previously that at Axxess, we made the early decision in our organization to do all we can to help stem the spread of the virus by having our people working from home. So we went from being a partially virtual organization to being totally virtual. So we've been working from home now for about 5 weeks, just everyone spread out across the country and globally, really, working from home. And it was very important that we did that. And, just communication is important. As I said earlier, you cannot over communicate at this time. So we serve thousands and thousands of organizations nationwide and internationally, and they depend on us to be able to keep running smoothly. So it was important first and foremost to make sure our people, Axxessians, are empowered to help support our clients and our industry. So while working from home, we educated them on what COVID-19 is and explained all that to them. And we have daily meetings across the organization where we're letting our people understand what's going on. And as things change, we're providing them updates and also ensuring that they can get that information out to our clients. in the past, I'll send out a quarterly notice to the entire industry, saying from my desk, this is what I'm seeing. But I realized there's a need to communicate a lot more frequently now. So what I'm doing is weekly communications to the entire industry, not just our clients, because what we have found is a lot of organizations depend on Axxess for education and thought leadership in the industry. And one of the challenges with COVID-19 is, where do I go for information? Who's a trusted resource that I can go get good information? And the industry certainly trusts Axxess. So I'm also making sure on a weekly basis now, I'm getting information out to the industry about what I am seeing. So we have the benefit of seeing things across the entire country. And we want to make sure all the wisdom that we get from that, we can share that with our clients and help them be even more successful. So early on, internally, we created an emergency preparedness team across all internal teams to share knowledge, research the facts, actively engage in public policy and industry advocacy. I know Jennifer has been working on that. We've been working on that as well, making sure all the advocacy groups in the industry, making sure our regulators understand that, look, now is the time for healthcare at home. If you really care about not overwhelming hospital capacity, you have to leverage this incredible resource that's the home health industry to help you deal with this surge that's coming, and make sure that we're doing all we can to make sure our regulators understand what that is and eliminate red tape. So examples of letting caregivers work across state lines, we're really excited about that. And we're really proud of what CMS has done to eliminate red tape and provide additional resources for our providers to be successful. So we are a partner. So we're thinking beyond technology. We know when our clients are successful, we're successful. So that advocacy work is very important to us as well, to ensure we keep elevating the quality of care delivered in the industry as a whole. We also created an online COVID resource center where folks can go get information about things, just all things COVID related. And then as things change, we can share that information with them for home health and hospice. So we can centralize all the available wisdom, regulations, protocols, technology. And we have videos, webinars, blogs, links to CDC, to CMS, just a lot of information that our folks need. And we've had a lot of clients saying, look, I trust Axxess for my information. That's where I go to get the information. And we did an industry survey, because when there's a crisis, you're thinking, well, I'm going through this crisis. I wonder what other organizations are doing. So what we did is we quickly put together a survey to hear the challenges that the industry is facing. And the results show that there are two things that were really an issue for our industry. Jennifer touched on one of them already. PPE was a big issue. And the second thing was cash flow. So we're a technology provider. We provide technology, and we've made investments to update our software and make sure all the issues around emergency preparedness and infection control are front and center. Our clients have that. We're doing all the COVID worksheets and different tools to help them be successful. We've done that. So our question was, what more can we do to help out? So we actually leaned in on the PPE issue as well. So I had someone reach out to me directly and say, hey, I've got access to PPE, and if you know folks that need that, I can help get it to your clients and your industry. So what we did was partnered with this gentleman, and they shared that information with our clients and the industry, and we're aggregating demand from across the industry to this organization. And they were surprised. They said, I didn't realize how important healthcare at home is. So what we're doing is having cargo planes fly PPE supplies to our region, and then home health organizations as well. So we're not just thinking, let's provide software to help our clients be successful. We're saying, what more can we do to help them be successful? And if we can weigh in on PPE, we must. And we did that, and we're continuing to do that as well to make sure our clients and the entire industry can be successful. So staffing has historically been a challenge in the home health industry, and that challenge is even more acute now with COVID-19. So what we did is we have a revolutionary staffing and scheduling solution that we call Axxess Care, which essentially Uberizes healthcare at home. We had rolled it out in 7 states already. Well, there's so much demand from clients and even just home health organizations nationwide saying we need more people, we can't get access to staff as quickly as possible. is there something you can do about this issue? So beyond PPE, we decided to roll out our Axxess Care solution in an additional 16 states to match qualified caregivers to home health nurses. And with the new regulations where folks can work across state lines, we're really helping move the needle on helping providers get the access they need. So for instance, in the Illinois market, there were caregivers that can now go to Wisconsin to get work done and see patients there where they couldn't do that before, leveraging our technology. So it's important that it doesn't matter what the geographic area is, if the Axxess Care solution is there, we can make a difference. So that's really addressing workforce challenges and then offering the flexibility needed, especially now during COVID-19. Locally, for my work in the business community, I mentioned earlier that it was important that we're totally galvanized in the Dallas region as the leader of the business community here. It was important for me to galvanize the entire community and make sure we're totally aligned, we're speaking with one voice, and we can harness the wisdom and the resources and the innovation that business leaders can bring to help our community and political leaders. In fact, right before this call, I was on a call with business leaders and representatives from the city, and our county judge was on that call. And what we're trying to do is bring all the best thinking, all the best wisdom to bear to ensure that we can drive success for our region, and then take all the wisdom that we're gathering from there and share that in our industry and our clients. So I send a note daily to Axxess, to our people, explaining what I've done every day just to help around this issue. And every morning at 7 a.m., I have a meeting every morning since this COVID-19 crisis with political and business leaders working on the same issue. What more can we do? How can we make sure this curve is flattened? How can we make sure we can fight effectively? How can we make sure we can protect our future? So we're even working with all the leaders to say, well, what does recovery look like? And the way I see it is, and I've shared this publicly, the communities that are best organized are the communities that will deal with this crisis most effectively and ultimately recover the fastest. That wisdom applies to our industry. That wisdom applies to home health organizations as well. The organizations that are internally most organized will be the ones that will get over this the quickest and recover and be effective, and same for our industry. And I just want to say that Jennifer Sheets is an incredible leader. I'm so proud of what's happening at Interim. We're a partner. I see firsthand what's going on in that organization, and it's just totally frustrating. They're very organized. They're prepared. They're dealing with these issues effectively. They helped out at the epicenter of the issue in Seattle, and they're continuing to lean in to help not just her organization, because I know Jennifer ordered PPE for the entire industry. So I think that's the collective effort that's necessary for leaders in this industry to weigh in, do what's right for your organization. But beyond that, COVID-19 is not limited to just one organization or one industry. It's a global pandemic. We've never seen anything like this in our lives. And we need all the wisdom that we need across organizations, across communities, just all the expertise that we need to do all we can to help us get through it.
Let's shift gears a little bit here, still kind of keeping COVID-19 in the background, but I also want to touch on things like PDGM and the shift towards value-based care. Jennifer, Interim's really focused on value-based care, high quality. What are you noticing in terms of CMS trying to downshift care to the lowest cost setting, which of course is the home?
Yeah, I think, first of all, I'll say at a high level, I think the work very much at hand is to change the perspective again of home health and hospice, and really help CMS realize that we are already taking older, sicker, more chronically ill patients in our setting. And the reality is we have to be embracing as an industry complex care management. That's what the value-based world is all about. So it's about being able to connect the dots across the continuum and to be able to incorporate, right, the social determinants of care, the other things that are affecting somebody's ability to heal, and to be able to head off some of those higher cost settings. That's what the goal is. And so helping CMS to understand that if they're really trying to be intentional in downshifting care delivery, we have to be proactive. How do we not only, right, move people from the hospital setting to the home setting? How do we prevent people from having to go to the hospital in the first place, right? How do we build, for example, emergency diversion plans and programs based on what the person's presenting with? We have to get creative, and I think it, for me, if CMS really starts to bring the entire continuum together, there's a solution there. PDGM was a huge change for our industry. I don't agree with, some pieces of the regulation, certainly a behavioral modifier. That one was frustrating for me, especially because it assumed that behavior, at 11:59 on December 31st was going to be greatly different than behavior on January 1st, of 2020. And I think that that's the kind of conversations that we need to be having. And again, going back to the level of care that we provide, I can tell you, from my experience in the hospital world, certainly as a CEO, I had no idea the critical role that home care, home health, hospice, home care could play in helping me manage that length of stay and helping me reduce the healthcare dollar spend and keep people out of my hospital. And from the clinical perspective, just to add there, my background was in an extremely technical, high acuity ICU setting, but I never had to deal with, a sterile field and a cat jumping in the middle of the bed while I was doing a dressing change, right? And I always had a code blue button, and I always had people around me that I could scream, when I needed help. And I will say personally, I never realized the skill and the competency that home care clinicians really have and are already delivering until I was in the space. And that's the reality, Bob, of what we have to change at the very foundation if we're truly going to realize value-based care, across the entire healthcare continuum. And the reality is, I would say, one of the biggest challenges I think we have in our industry is that we are fighting with, fast food restaurants or retail businesses for some of our caregivers and aides. And the work, obviously, of the home care worker is challenging, right, both physically and emotionally. And we need to be thinking about, if we're going to truly move care to a lower cost setting, we have to incentivize these people to want to be on the front line. This is a pool that's already prone to high turnover. So we can't even begin to shift care delivery from more of the acute to the post-acute lower cost setting if we're not paying, right, enough to keep or to recruit and or keep people, on the front line providing care in the home. In my opinion, that the real answer to value-based is the provider, home care provider, the skilled nursing provider, the rehab provider, the health system provider, partnering together and really becoming an invaluable solution for the full continuum, partnering with Medicare Advantage plans and payers, and really addressing how those social determinants will change the health trajectory and the path for each individual patient. It's connecting data. It's linking the invisible, right? That only comes, by the way, through human interaction. Technology can do a lot of wonderful things and can get you so far, and then adding that the human interaction really to create true value through prevention, avoidance, and ultimately the right designed care plan for that unique individual. I personally, and kind of wrap that up, believe that to achieve this and to be sustainable, we have to continue to advocate. Again, I know I've said it like 5 times, but I think it's huge to advocate as a strong and united industry with CMS, Congress, state legislators, public, private payers, anybody that will listen to us, to really ensure the regulatory environment and payments are appropriate. And then ultimately we are paid fairly for the services and the outcomes that we provide, which is how we will help alter the employee value proposition of the home care industry, and ultimately where the best clinicians will want to do their best work and where a high level of care can be provided.
Yeah, and just my quick kind of observation from home healthcare news is sometimes it definitely could seem difficult to move the needle from an advocacy perspective, but the home-based care sector obviously is doing a great job. Last month we had an executive from a very large home health company right next to President Trump during the national address. So, I mean, the industry's voice is definitely being heard. That advocacy will remain important, in coming months. John, let's get you back into the conversation. What's your take on some of the things that Jennifer just highlighted when it comes to CMS downshifting care into the home? What's your take on PDGM and this new value-based world that we're trying to operate in?
Thank you, Bob. I think, first of all, what I want to do is take us all back to how healthcare started. Healthcare started in the home. And what I share with people is technology has influenced the evolution of healthcare a lot more than we realize. So in the early days, you had visiting physicians or nurses, just whatever caregiver, going to go see patients in their home. And when technology got into healthcare, there was a need. You had huge diagnostic equipment and things like that, and there was a need to place patients close to the technology at the time, and that's how hospitals got created, and you had hospital beds. Well, healthcare has come full circle. People are in their homes now, and your phone is a very important healthcare device. And as technology increases and gets better and gets more sophisticated, healthcare is back in the home now. But we cannot take for granted that everyone understands that. There have been decades and decades of thinking in acute care settings for how healthcare should be delivered. So as an industry, this is leaning into change. So when we're thinking about change, not just for our industry, for our community, for our society as a whole. So I mentioned earlier what I understand leadership to be. Leadership is accepting responsibility for a desired outcome. So the outcome that we all want is better care for our people in the most cost-effective manner, in a sense that makes sense. If you ask anyone, they'll tell you they would rather be at home than go in the hospital and catch an infection. In the past, we'll say sepsis. Now we all know something a lot more infectious. We're talking about COVID-19. So as an industry, our outcome that we're looking for is to educate everyone about the value of care in the home. And I've always wondered why some of our regulators in some cases vote against their own self-interest. So I just want to say that. The second thing is, we talk about culture. When people think about our industry, what's their understanding of what the culture in the industry is? And it's important that we keep projecting, as Jennifer said, a culture of excellence, a culture of leadership. So we need to let our regulators know that we cannot keep reacting to policies. We need to cast our vision for the future of healthcare being in the home, which will let them know that we can take care of complex patients in the home, and that we have technology today to empower them and make sure that's happening. So let's lean into this change and not be reactive. Let's cast our vision, and let's keep doing all we can to communicate and make sure everyone understands that. Now, we know that at Axxess, we think about how we empower the delivery of the highest quality care. As an industry, we need to keep making sure that we're not just sharing all this information anecdotally. We should have data, research, facts, information, a common set of facts that we can all speak out of and project that and let everyone know, whether you're the consumer on the street or you're the regulator in DC, that look, care in the home is that's what people want already, but we need to provide additional facts to help people understand that. We're not just talking about it, but it's where innovation is. It's where you can get the best outcome. It's what we're looking to do. And changes, it's constant. And what I say is, I mentioned earlier, leaning into changes, leaning into growth. Our industry needs to lean into that. And the way I think about growth is it's binary. You're either growing or you're dying. You cannot sit on the fence there. So as we're thinking about this, in my role as a technology leader in this industry and as a business leader in the work that we're doing at Axxess, we're not just even passive in our engagement with our clients in the industry. We are saying this is the outcome that we want. We're concerned about delivering quality care services, and we don't want to wait for the clients or the providers to have that conversation alone. We have a seat at the table. We have public policy leaders saying we want to lend our voice and share technology solutions and let people know the incredible work that healthcare at home organizations are doing. And it's the right thing for patients from an outcomes perspective. On the cost side, it's easy to make that case, but from an outcomes perspective, there's an opportunity for us as an industry to keep pushing that. We cannot do that without technology. So you don't want to engage a technology provider as someone that's just giving you technology and you do all the work yourself. The reality is, in this day and age, if a technology partner is not invested in the outcomes and the quality of care and how this shakes out, then there's a challenge there. The future of care in the home that I envision is one where I'll be getting healthcare at home services one day, and I'm looking forward to getting the types of services that Axxess has partnered with leading healthcare at home organizations to create. So I'm excited about that. And the type of care that I want in the future is the one that I am creating. It's the one that we're creating at Axxess. And we need to keep leaning in, whether it's education, advocacy, outcomes, all of that, to educate all the stakeholders, consumers, regulators, and then lock arms to make sure we can get this message out. No one person can do it alone. That's the kind of change that we're talking about. We all need to lean into it and lean into the growth opportunity that all the dust is creating for all of us.
I want to wrap with one final question to both of you. And Jennifer, if you don't mind, let's start with you. Taking all of the things that we just talked about into account, do you think that ultimately, once the dust settles on this public health emergency, does the home-based care sector come out stronger, or are there ultimately going to be setbacks?
Yeah, I think my hope is that out of this crisis comes a increased awareness, again, of what home care can provide. I do think there's going to be a recovery period, especially when you look at some of the more non-clinical services like supportive care. I know that folks that primarily offer those services have seen a big impact, or therapy-based cases. I think overall the industry will come out stronger. And if, again, going back to what we've talked about kind of in this time, if people start to understand the critical role that home care does, and should play, right, in the future of healthcare delivery, hopefully regulations and partnerships, will follow. And I will say, specifically kind of in closing from my perspective for Interim and Caring Brand specifically, we have 53 years, right? We were the first in home care. We continue to be involved. We're always going to be at the table. We're always going to be advocating and building on kind of our strength in our marketplaces. And most importantly, partnering with forward thinkers, people that lead into change, like we just talked about, people like John Olajide, and industry-leading technology solutions like Axxess continues to deliver, so that we can have a deeper connection to our communities and we can continue to meet the need of our communities that we all serve long after this crisis has passed. And that's why we're different as home care providers, right? We are local folks providing care in the most intimate setting, and we're committed to the communities that we serve. And that is the reality of what I hope everybody's going to know as we come out of this crisis.
All right, Jennifer, thank you so much. It was great hearing from you. Before we wrap, John, anything else that you'd like to add to Jennifer's kind of concluding remarks there about
Yes,
home care coming up?
My answer, Bob, to that question is yes, with a caveat. We cannot let things happen to us. We have to lean into the change. That's what we're talking about today. So as an industry, we have to accept responsibility for the outcome of educating everyone, and especially regulators and policymakers, about the value of care in the home. That's very important. Secondly, it's important that we keep projecting a culture of an industry that's as healthcare leaders. So we cannot be perceived as just the backwaters of healthcare. We should be at the forefront. We cannot wait for the change to happen and it just happens. We have to create the change that we seek. We have to lean into this change and keep educating everyone. And as an industry, we need to make sure that we're delivering such excellent care that the data and the information supports the fact that we're the best healthcare delivery setting, not just the most cost effective. So I think, and I assure you that as a technology provider, we are committed to partnering with our clients and the industry to ensure that's the case. And we're not going to wait for this to happen to us, Bob. we will lean into this change and create the outcome we want. And then we'll lead, we'll challenge, we'll coach ourselves and the entire industry to make sure that's exactly what happens.
Well, that seems like the perfect note to end this conversation on. Big thank you again to John and Jennifer for their time today. And a big thank you again to Axxess for sponsoring this conversation and putting it together. And thanks to all of you for tuning in. As a quick reminder, all attendees will be receiving an audio copy of this conversation shortly. HHCN and Axxess will get you everything you need in about a day or two, so just keep a lookout on your email inbox. This is HHCN editor Bob Holly signing off. Hope you all have a good rest of your week.
Thank you so much.
Thank you, Bob. Thank you.